Hi everyone, let's try this again. It's Get Her Done Giget RNY, and this is my second try for this video because it stopped recording for some reason. Anyways, let's start over. So I have been MIA, I guess, for the past 2 weeks since my surgery date. Mainly because the past 2 weeks have been crazy. I wrote lots of notes down here, so I'm going to be looking down. The surgery went well. My surgery date was October 27th. And everything went fine. The doctor had to fix the hiatal hernia. I thought it was small. They said it was actually kind of medium to large. But that, I guess added extra pain in the recovery part of it. But surgery took a little bit longer than I thought it was going to take. My husband was a little bit worried. I guess I'm a hard recoverer, I guess. I just don't like to come out of sleeping, so I stay in recovery until I'm awake, I guess. But I don't remember any recovery room. I just remember, getting wheeled away to go to surgery, and then all of a sudden I'm in my room in pain. But Monday was fine. The doctor came in, and he says that there's a small bruise around the where the camera site is on the left side, and he says that either a stitch, he stitched it too tight, or he maybe nicked the muscle on the way out, pulling the camera out, I guess. But he says it's nothing to worry about. It happens maybe once every 2 years, and lucky me, it was me. But he said, we'll just keep an eye on it and see how it goes. So I was like, okay, whatever. But I became a star patient. I did my laps. I got up and down by myself. Went to the bathroom, back and forth, passing gas, burping, everything that, was required of me, I was doing. So I became like their star patient, and they're like, oh, you're going to be out of here fast. So I went in Monday. I was supposed to get out Wednesday. So Wednesday morning, I'm doing my morning lap and talking to my husband as we're going around in circles. And I said to him, I'm like, nobody has checked this bruise thing or any of my sites since Monday. I'm like, do you think that's normal? Especially since he said, there was internal bleeding and stuff. And he's like, I don't know. So we went back to the room, and they said that they had to check my hemoglobin levels to make sure that everything was okay for me to go home. And so they pulled a little vial of blood out and sent it off to the lab. And this was, it was probably like 7 o'clock in the morning when they did that, and by like 9:30 the doctor walks into the room, and he's like, how you doing? And I'm like, and just prior to that, I made one lap, and my husband's like, okay, you're gonna do another one like you normally do. And I'm like, you know what, I'm not feeling so hot. I'm like, I need to sit down. So we went back to the room, and I sat down, and the doctor came in soon after that, and he's like, let me see that bruise. So I showed it to him, and I guess we'll show you a picture of it, but it had extended. It was huge. It looked like somebody took a baseball bat to the side of my to my side. And he's like, he's like, well, your muscle continued to bleed a little bit more than I expected it to, so we're going to put a binder on you, which I guess everybody gets the binder, but I hadn't until that point. We're going to put a binder on you to try and compress the muscle to stop the bleeding, because it's still bleeding. And we're going to have to give you some blood because your hemoglobin levels are too low. So I was like, okay, no problem. I had already had blood given to me when I had my first son because it was an emergency C-section, and I guess my uterus never stopped hemorrhaging or something, so they gave me blood then. So it was no big deal. I was like, okay, whatever. But he told me that that I would have to stay in bed. Pretty much I could go to the bathroom and get back in bed until my hemoglobin levels got raised. I wasn't allowed to walk or do anything that was normal for us. So I was like, okay, let's get this blood started so I can go home. So I was thinking, okay, at the latest I can go home Thursday. But they took another vial of blood to check my blood type and to check to see if I have any extra antigens, is what I was told. And come to find out, I do. I have a special antigen. It's called a JKA antigen. And my husband calls it just kidding antigen. Which it's not funny because I guess this antigen is pretty rare for everybody to have. So I guess if they give me a bag of blood that doesn't have the antigen, my body would reject it. So 9 a.m. I find out that I'm going to have to get blood. They couldn't find a bag of blood with the antigen until like 4 is when I first got my first bag. And then they were continuing to look for more just in case. And it takes 4 hours to get a bag of blood, by the way. So laying there, doing whatever, getting the blood. So it's from 4 till 8. I'm getting the blood. Then they finally found another bag, and that was like 1 a.m. And by that time I'm tired. I'm like, just hook it up. I'm going back to sleep. I don't care. But unfortunately, when they first hook up the blood, the nurse has to stay in the room for 15 minutes. So the lights are all up. You know, the nurse is sitting there and making sure that nothing, you know, I'm not going to have any adverse reactions to it. So second vial of blood, 1 a.m. So that finishes at 4 a.m. Then probably like 9, 10 o'clock that morning, they check my blood again, my levels, and they're still not high enough. So they order 2 more bags of blood. And luckily, they had found 2 more. So I was able to get more blood on Thursday very uneventfully. So I think they finished with all the blood probably about 7, 8-ish in the evening. At midnight, they took a vial of blood to send down to the lab to see if my hemoglobin levels were high enough. And then, of course, they had to wait 5 hours and check it again to make sure that they weren't going down from the initial. So crazy, crazy so far. But after the 4th bag of blood, everything's fine. So I finally get to go home on Friday. And of course, because I wasn't allowed to walk and everything, I'm cramped and tired and sorry, my husband. And I just wanted to get home. I was tired of being away from my house. You know, I just needed to relax. First night I slept in my recliner. Actually, first 2 nights. I didn't get to. I was kind of worried about sleeping on my back, just because I didn't know if I could get up. But first 2 nights slept in my recliner. My husband slept on the couch nearby, just in case I needed to get up. So Monday we finally get to sleep in our own bed. But of course, lucky me, Monday night as I'm going to bed, I'm having kidney pain. that feels exactly like a kidney stone. And, you know, I've had previous kidney stones. And, sorry about that, my computer like timed out. I've had kidney stones before. My family's actually prone to them, so all that extra calcium that we were having with the vitamins and stuff, my kidney can't process that much. So, kidney stone pain all day Monday nights. Tuesday morning, I'm calling my PCP. She can't see me. I already have a Wednesday morning appointment with my surgeon. So I'm like, okay, can I deal with the pain until Wednesday when I can see my surgeon and possibly, you know, either get pain medication above and beyond what I already got from the hospital, or something, just to get verification, I guess. Wednesday, so I did. I dealt with the pain for 2 nights. Wednesday, I get up, still having some kidney pain, uncomfortable. If anybody's ever had a stone, you can't get comfortable. You stand up, you sit down, you push, you pull, you're sideways and back and forth, and you can't get comfortable no matter what position you're in. So, you know, anyways, so he knows that I've got something with my kidneys because he can tell that, you know, I'm uncomfortable. I can't sit still. So he sends me over to the hospital to get a CT scan. And we were 45 minutes from my house. And I watched preschoolers, and I had dropped one off and at 9:15, and I had to pick him up by 1:15. And there was no guarantee that the hospital was going to be able to do the CT scan and I was going to be able to get back in time to pick him up. So I was like, forget this. So I left the hospital, went to my normal imaging place or whatever to get an appointment with them. And, you know, it took all day for them to get clearance from my insurance, whatever. Anyways, finally, Wednesday evening, 5:30, I'm getting a CT scan. The doctor calls me Thursday morning and says, we didn't find a kidney stone. I'm like, I didn't figure you would because the pain's gone now. I get a couple twinges, but it's gone. I'm good. I passed it. So, but he's okay with me not taking the extra calcium, which is awesome. So that's great. But I'm looking at my notes, and because I'm 13 minutes in. Luckily, I'm recovering faster than I thought I was. You know, I mean, last night I did a treadmill workout. I walked for almost a full mile, and it took almost 40 minutes. It was like 9.97 for 917. Anyways, it was okay. But this morning I'm waking up and I feel pain. I think it's where the hernia was. So I'm thinking that I might have popped a stitch or something, and it's kind of there. So crazy. Okay, looks like I'm going to have to do a part 2. Hold on.